As global temperatures reach record highs in early 2026, public health officials are tracing a significant surge in hantavirus infections back to radical shifts in the Earth's climate. The current year, which meteorologists predict will be the hottest in recorded history, has created a perfect storm for the expansion of rodent populations, the primary reservoirs for this viral pathogen. While hantavirus is not a new threat, the scale and geographic reach of recent outbreaks have prompted the World Health Organization and the Centers for Disease Control and Prevention to issue urgent alerts. The focal point of international concern currently centers on a multi-country outbreak linked to a cruise ship in the Atlantic. But the underlying drivers are ecological. Experts indicate that a combination of extreme weather events, including a historic drought followed by intense rainfall in South America, has fundamentally altered the habitat and behavior of the rodents that carry the virus in the southern cone of South America. Specifically in regions across Argentina and Chile, the phenomenon of masting, where trees and plants produce an abundance of seeds, has been supercharged by the current El Niño cycle. This surplus of food has led to an explosion in the population of long-tailed pygmy rice rats and other members of the Crescentidae family. As these rodent populations grow, the competition for resources increases, driving animals out of their natural habitats and into closer proximity with human settlements. This ecological displacement is the primary mechanism behind the current zoonotic spillover. When rodents occupy human-inhabited areas like barns, sheds, or tourist accommodations, they leave behind waste containing the virus. Humans are generally infected through the inhalation of microscopic particles, or aerosols, contaminated with the urine, droppings, or saliva of these infected rodents. The framing of this crisis by senior epidemiologists is clear. Climate change is no longer a distant variable, but an immediate catalyst for viral emergence. In warmer climates, the breeding seasons for these rodents are prolonged, and the survival rate over winter months has increased. Furthermore, as the virus persists in these expanded animal reservoirs, the statistical likelihood of human exposure rises. Public health reporting indicates that the current surge is not merely a localized event, but a symptom of broader environmental instability. In Europe, higher temperatures have been linked to increased outbreaks of the Pumala hantavirus, driven by similar shifts in seed production and bank vole population growth. This global trend highlights a critical vulnerability in the intersection of environmental health and human security, where the disruption of natural ecosystems creates favorable conditions for pathogens that were previously contained within stable ecological niches. The core of the current international response began on May 2, 2026, when the United Kingdom notified the World Health Organization of a cluster of severe acute respiratory illness among passengers and crew aboard the cruise ship MV Hondius. The vessel, which had departed from Ushuaia, Argentina on April 1, became the center of a complex epidemiological investigation involving health agencies from 23 different countries. Laboratory analysis performed by international partners confirmed the presence of the Andes virus, a specific strain of hantavirus endemic to South America. What makes this development particularly concerning to the global medical community is that the Andes strain is the only known hantavirus capable of person-to-person transmission. While this form of spread remains rare and typically requires close, prolonged contact with a symptomatic individual, the cruise ship environment provided the enclosed spaces and high density necessary for such an event to occur. As of mid-May 2026, the World Health Organization has reported 11 confirmed and suspected cases linked to this single vessel, including 3 fatalities. The clinical progression of these cases follows a predictable but devastating pattern known as Hantavirus Pulmonary Syndrome, or HPS. Patients initially present with non-specific symptoms such as fever, severe muscle aches, and fatigue, which are frequently mistaken for common influenzas or even COVID-19. However, within days, the condition often progresses to acute respiratory distress as the lungs fill with fluid. In the most severe cases, the case fatality rate can exceed 35%. In response to the ship's arrival in the Canary Islands, the CDC dispatched a team from its Viral Special Pathogens branch to coordinate with Spanish authorities and international partners. This team is tasked with assessing the exposure risk for passengers and implementing strict monitoring protocols for those who may have been in contact with the infected individuals. The surge is not limited to maritime travel. Data from the Pan American Health Organization for 2025 and the first half of 2026 show a marked increase in HPS cases across Argentina, Brazil, Bolivia, Chile, Panama, and Uruguay. In Argentina alone, the number of recorded infections in the past year has nearly doubled compared to historical averages. Laboratory testing, including ELISA for antibody detection and RT-PCR for viral RNA, has become the frontline for confirming these cases. However, health officials note a significant challenge. Because early symptoms are generic, many patients do not seek specialized care until the disease has reached a critical stage. This lag in diagnosis, combined with the lack of a specific antiviral treatment, places an immense burden on intensive care units, which must rely on supportive measures such as mechanical ventilation or extracorporeal membrane oxygenation, known as ECMO, to keep patients alive while their bodies fight the infection. Prevention and surveillance remain the primary tools for mitigating the impact of the current hantavirus surge, as there is currently no globally approved vaccine for the strains most prevalent in the Americas. Public health guidance issued by the CDC and WHO emphasizes the importance of rodent-proofing homes and workplaces, particularly in rural and peri-urban areas where the interface between humans and wildlife is most active. Officials recommend that individuals avoid stirring up dust in areas where rodents may have nested. Instead of sweeping or vacuuming, which can aerosolize viral particles, contaminated surfaces should be thoroughly soaked with a disinfectant solution, typically a mixture of bleach and water, before being wiped down. The use of personal protective equipment, including gloves and high-efficiency particulate air masks, is strongly advised for anyone tasked with cleaning potentially infested spaces. Surveillance programs are also being expanded to monitor the viral load within rodent populations themselves. By trapping and testing rodents in high-risk zones, scientists can identify hotspots before human cases begin to emerge. This proactive, ecological monitoring is part of a broader One Health approach that recognizes the inextricable link between animal, human, and environmental health. However, significant limits of knowledge remain. Researchers are still working to understand the exact threshold of humidity and temperature that triggers a spike in viral shed among rodents. Furthermore, the potential for other hantavirus strains to adapt to human-to-human transmission is a subject of ongoing laboratory study and high-level concern among biosafety experts as the international community grapples with the 2026 surge. The focus remains on rapid reporting and the strict application of the international health regulations. The goal is to contain clusters like the one seen on the MV Hondius before they can trigger wider community spread. For travelers, the guidance remains calm but vigilant. Be aware of the symptoms, report any recent travel to endemic areas to healthcare providers, and practice rigorous hygiene when in rural environments. While the link between the climate catastrophe and the rise of rodent-borne diseases is increasingly definitive, the effectiveness of the global response depends on the speed of detection and the transparency of data sharing between nations. We will continue to monitor official statements from the WHO and local health ministries as this situation evolves. Subscribe to this channel for more in-depth reporting on global health security and emerging viral threats. As the surge in hantavirus cases intensifies across diverse geographic regions, the clinical and laboratory response has moved into a state of high alert. National health agencies, including the Centers for Disease Control and Prevention and the European Center for Disease Prevention and Control, are currently prioritizing the standardization of diagnostic protocols to address the diagnostic lag that often proves fatal. Because the initial symptoms of hantavirus infection, fever, headache, and severe muscle aches, closely mirror common viral illnesses such as influenza or leptospirosis, many patients do not seek specialized medical attention until they reach the critical second phase of the disease. In the Americas, this second phase is characterized by Hantavirus Pulmonary Syndrome, or HPS, where the virus attacks the capillaries in the lungs, leading to rapid fluid accumulation and respiratory failure. In Europe and Asia, the predominant form is hemorrhagic fever with renal syndrome, or HFRS, which targets the kidneys. Medical facilities in high-risk zones are being instructed to implement a high index of suspicion for any patient presenting with acute respiratory distress who has a history of potential rodent exposure. The laboratory confirmation of hantavirus remains a complex technical challenge. Because these viruses are highly infectious in aerosolized form, suspected samples must often be handled in biosafety level 3 or 4 laboratories, depending on the specific strain and local regulations. The diagnostic process typically involves a multi-tiered approach. Serological testing for IgM and IgG antibodies via ELISA is the standard for detecting the body's immune response, but during the early prodromal phase, these antibodies may not yet be present in detectable quantities. Consequently, clinicians are increasingly relying on reverse transcription polymerase chain reaction, known as RT-PCR, to detect viral RNA directly from blood or tissue samples. This molecular approach offers the highest sensitivity but requires sophisticated laboratory infrastructure and a cold chain logistics network to ensure samples remain viable during transport from remote rural clinics to centralized reference labs, parallel to the clinical response. Ecological surveillance has become the primary tool for predicting where the next clusters will emerge. Public health scientists are focusing on the masting events mentioned by experts as a primary driver of the current rodent surge. In South America, the abundance of bamboo seeds and other mast crops has led to a population boom in the long-tailed pygmy rice rat, the primary carrier of the Andes virus. In the United States, similar patterns are observed with the deer mouse and the white-footed mouse. Surveillance teams are conducting routine trapping and seroprevalence studies where rodents are captured, tested for the presence of the virus, and released. This data allows officials to calculate the minimum infection rate within a local rodent population. When this rate exceeds a certain threshold, localized health alerts are issued to warn residents and travelers of the increased risk of zoonotic spillover. The role of the World Health Organization has been to coordinate the international sharing of genomic sequencing data. This is critical for monitoring the evolution of the virus, particularly the Andes strain, which remains the only hantavirus variant with documented person-to-person transmission. While the majority of hantavirus infections are isolated dead-end events where the virus does not spread beyond the initial human host, the possibility of viral adaptation in a rapidly changing environment remains a subject of intense scientific scrutiny. Trade and travel authorities are also monitoring shipping routes, as rodents are known to stow away in cargo and shipping containers, potentially transporting the virus to new ecosystems. However, experts emphasize that the primary threat remains localized environmental exposure rather than international trade. The current developments underscore a critical gap in our public health infrastructure: the lack of a specific antiviral therapy or vaccine. Current treatment remains strictly supportive, focusing on oxygenation and hemodynamic stabilization, which places a significant burden on intensive care resources during a widespread surge. As the 2026 surge in hantavirus infections continues to track with extreme climate fluctuations, public health authorities are doubling down on prevention strategies that emphasize the disruption of transmission at the environmental level. According to the World Health Organization and the Centers for Disease Control and Prevention, the most effective means of preventing Hantavirus Pulmonary Syndrome and hemorrhagic fever with renal syndrome remains the rigorous exclusion of rodents from human dwellings and the safe decontamination of inhabited spaces. Official guidance currently stresses that prevention is not merely an individual responsibility, but a critical component of community-wide public health surveillance. For residents in high-risk zones, particularly in rural and peri-urban areas where rodent populations have exploded due to recent masting events, the primary directive is to eliminate food sources and nesting materials. This involves storing all animal feed and human food in rodent-proof containers and sealing any entry points in buildings larger than 1/4 of an inch. The methodology for cleaning potentially infested areas has been standardized to prevent the aerosolization of the virus, which is the primary route of human infection. Health departments are issuing urgent reminders that dry sweeping or vacuuming in areas with rodent droppings is strictly prohibited, as these actions launch viral particles into the air where they can be easily inhaled. Instead, the wet cleaning protocol is the mandated standard. All droppings, nests, and contaminated surfaces must be thoroughly soaked with a disinfectant, specifically a solution of 1 part bleach to 9 parts water, for at least 5 minutes before removal. This process ensures the virus is rendered inactive before it is disturbed. For individuals engaged in the cleanup of heavily infested areas, the use of personal protective equipment, including non-porous gloves and N95 or higher-rated respirators, is no longer suggested but categorized as a critical safety requirement beyond individual household measures. The current public health response is increasingly reliant on a One Health surveillance framework. This involves the integration of satellite climate data, rodent population density tracking, and real-time clinical reporting to create predictive models of viral emergence. By monitoring the specific temperature and precipitation thresholds that trigger rodent breeding booms, officials in 2026 are attempting to issue pre-outbreak warnings weeks before the first human case is identified. However, significant limits to our knowledge persist. While the link between climate change and hantavirus expansion is statistically supported, the exact biological triggers that cause a virus to spill over from a stable rodent reservoir into a human population remain under intense study. Furthermore, there is an ongoing lack of specific FDA-approved antiviral medications for the treatment of New World hantaviruses, meaning the medical community must still rely on early intervention supportive care and advanced life support technology like ECMO to manage severe cases. The ethical dimensions of the current crisis are also coming into focus as health agencies confront the reality of disparate access to high-level, intensive care in the rural regions most affected by these outbreaks. Public health reporting indicates that the mortality rate is significantly higher in areas where patients must travel long distances to reach a facility equipped with mechanical ventilation. As we move further into 2026,